changed our lives for the better. For example, robotic surgery is now here with us, and it has made a lot of procedures, for the most part, less invasive, and it's become more common here in the Philippines today. Surgical advances here can even be compared with that of more advanced cities. And the outlook of these cutting-edge technologies is looking even brighter. On the program today, we'll talk more about the state-of-the-art surgeries in the country and developments that may one day be available to all Filipinos. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk on CNN Philippines. Healthcare technologies can improve the quality of life for many Filipinos. Our guests are here today to tell us what's in store for surgical care here in the Philippines. With us is Dr. Patrick Tuliao. He's a urologist and robotic surgeon from the Medical City. Also joining us is Dr. Hermogenes Monroy. He's the head of surgery at St. Luke's Medical Center, Global City. For the past 400 years, since modern surgery has been performed, it's been more or less a traditional way. Before we talk about the advances, let's talk about what is deemed traditional or normal, kumbaga. How are surgeries traditionally performed?
It's usually the knife, the open approach. We open the belly and then cut and then suture it and then close the belly again with sutures, with the big incisions.
Dr. Pat, when it comes to surgical procedures, is surgery the initial mode of management for most diseases?
There seems to be an equal amount of surgical cases with medically treated cases. But for the more serious diseases like cancer and stones and prostatic enlargement, we usually do surgery for those.
Most of the ailments that people have, hindi kaagad naman surgery ang option for that. But a lot of times, surgery may be the more practical way to address a disease or a problem. What are some of the drawbacks? You talked about an open incision here, meaning there is a direct line of sight between the surgeon and the problem area. What are some of the drawbacks of this type of procedure?
We have larger incisions, larger wounds, deeper wounds, more post-operative pain, and higher incidence of surgical wound infection. The recovery is quite prolonged or delayed.
But Dr. Pat, let's talk about this traditional way. Nakalimutan na ba natin to, or is this still part of the mainstay of a modern surgeon?
When we train, we usually start doing our surgeries the traditional open way before we learn the more advanced laparoscopic or robotic ways of doing them. I don't think we've forgotten these traditional open approaches, but slowly, because of the evolution of technology and that enable patients to recover faster because of the smaller incisions and less invasive approaches, then a lot of patients are opting what we call as modern approaches to surgery.
Briefly explain, what is laparoscopic surgery?
The other term for it, which is easier to understand, is keyhole surgery. So, for example, I need to take out the kidney. So, in the traditional way, I will make a big incision in the flank of the patient so that I can take out the whole kidney. But if I do it laparoscopically, I will just make 3 small incisions like this, and through those incisions I can insert my instruments and then do the whole surgery using just the 3 small incisions.
But Dr. Noneng, ano yung main advantage ng laparoscopic medicine if compared to that of the open type?
So, for example, for gallbladder stones, before the standard care is open surgery, making at least 10 centimeter wound in the subcostal area on the right. But now we make very small holes, 5 millimeter, 3 or 4 holes, and then without cutting the muscles, the fascia, and the fat layers. And therefore, patients are able to recover faster, return to work faster, lower incidence of infections. And that's why in some hospitals, particularly in private hospital in St. Luke's where I practice, the rate of laparoscopic surgery for gallstone is already at 98 and sometimes 99%. Only 1 to 2% are performed open.
Now, another surgical advancement that's revolutionizing the healthcare industry is robotic surgery. More on this when we return. We're your partner in healthcare. Keep it here on MedTalk Health Talk.
SMC, San Miguel Corporation. Bisag unsang industriya ang sudlan niini, tinguha sa SMC ang pag-uswag o paglambo sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement, gama sa Davao para sa Mindanao. SMC Davao Cement, ato ni Bay.
Ito ang RPN, Radio Philippines Network, DXKT 1071 sa inyong mga radyo, ang Radyo Ronda sa Davao.
Today, we're talking about surgical advancements in the field of medicine that can help empower Filipinos and ultimately improve everyone's lives. I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk. Now, an increasingly popular type of surgery is robotic surgery, and this refers to the use of specialized technology that enhances the capabilities of the surgeon's hands. I'd like to emphasize to the viewers that robotic surgery is a tool. The main star of this procedure is still going to be the surgeon. Controls and manipulation of the robotic machine will be by a human being. With that being said, Dr. Pat, how long has robotic surgery been available here in the Philippines?
I believe the first robot was purchased by Medical City. I know that I was still in residency when they purchased that robot, so that would have been around 2011 or 2012.
But Dr. Pat, how long has robotic surgery been available in other parts of the world?
I'm not mistaken, it's from the US, which was way back in 2006. So they probably did a lot of testing before they published that papers.
It is relatively new, but not that new that the ones operating it are still trying to figure it out. So all the fine-tuning is there, all the skill involved is there. Now, Dr. Noning, how important is the human element or the human factor here? Bakit hindi pwedeng yung robot na lang ang gagawa ng lahat?
Well, it's not an automated machine that we find in industry or car manufacturing. But so the surgeon is still the most important factor or element in robotic surgery. We totally control all the movements of the robotic hands or instruments.
Now, Dr. Noning, what are the main advantages which robot can do in a surgical procedure as opposed to minimal invasive like laparoscopic surgery and even open surgery?
It has shorter hospital stay, a lesser post-operative pain, and able to do more complex or more difficult procedures like pelvic rectal surgery, iliac node dissections, and those highly technical or complex procedure because of the different additional features that robot has compared to laparoscopy, like higher definition 3D camera system, articulated or better instrumentations, plus the surgeon is seated in a console, more relaxed, better ergonomics, and the instruments are able to work in very small spaces like the pelvic area or the iliac node area.
Can you use a robot with pretty much all the surgeries using laparoscopy or open type?
Speaking in general, yes, you can use a robot for any of the surgeries that you can do open, except for those that like for example, circumcision. I mean, you can still use a robot, but that's unnecessary. But in urology, we generally reserve using the robot for the more complicated procedures, especially those procedures that are done for cancer disease. like prostate cancer and kidney cancer.
Even if the robot can do several procedures, there's a practical reason and where to use that robot. Where does the benefit of robotic surgery come into play when it comes to malignancies or cancer surgeries?
Cancer cases in urology, for example, in prostate cancer, it's very hard to take out the prostate when you're doing open surgery. So when you use a robot, it becomes easier because you have a better visualization, and then the robot can actually do a lot of motions that is practically impossible for the human hand to do.
Is there any reason why a procedure that is currently being done under robotics would need to shift to that of an open type?
You start with a robot or a laparoscopy, but because of technical difficulties, then you convert to open surgery. You go back to open surgery to complete the procedure. But in robot, there is a very low conversion rate compared to laparoscopic approach. And this is true particularly for obese or very heavy patients and male patients with very narrow pelvis, where the conversion rate is usually higher in laparoscopy. So talking of limitations, I think the main limitation of robotics is really the cost. Rather than that, of course, availability and access to a lot of places in the country.
These technologies and much more have improved the way we do surgery. But there's so much more to learn with these advancements in technology. When we return, we'll discuss the outlook of healthcare here in the country. Your health is our mission here on MedTalk Health Talk.
SMC, San Miguel Corporation. Bisag unsang industriya ang sudlan niini, tinguha sa SMC ang pag-uswag o paglambo sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement, gama sa Davao para sa Mindanao. SMC Davao Cement, ato ni Bay.
Ito ang RPN, Radio Philippines Network, DXKT 1071 sa inyong mga radyo, ang Radyo Ronda sa Davao.
I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, where caring is our calling. Explain again, Dr. Pat, what traditional open type, what time frame are we talking about here, usually post-operatively, before the patient can go back to work, go back to their usual way of life?
For example, we have a patient who underwent open radical prostatectomy for prostate cancer. So that patient is expected to stay in the hospital for around 5 to 7 days before he can go home. And then he will wait for the wound to heal, which the wound will be around this big below the umbilicus. So that wound will heal in around 1 month, completely healed. So he can do any activity that he wants to do after a month.
With robotic surgery naman, Dr. Pat, if they opt to do robotic surgery for that same procedure, what kind of downtime are we talking about?
We expect that patient to stay in the hospital for around 3 days, and he can actually return to his regular activities earlier, usually in less than a month. And because the wounds are so small, there's very little discomfort for that patient.
Now, Dr. Noneng, let's talk about the cost of all of these advantages for that matter. Now, how much more expensive is a robotic procedure than that of the traditional way for that matter?
They say that it is 1.3 to 1.5 times more expensive than laparoscopic approach. We're talking about 100 or 200, 300,000 more pesos.
Is insurance coverage the same for robotic surgery as it is with laparoscopic or open type of surgery, Dr. Pat?
Unfortunately, in the Philippines, a lot of insurance will still not cover robotic surgery the way it's covered in other parts of the world. So most insurance companies will still classify robotic surgery as a new type of procedure, even if it's been here since early 2000s. So the coverage is still not there.
For the most part, it is still not covered by insurance. So the access there is something that our country, our government can work on. Now, Dr. Nonyeng, when it comes to access to healthcare, is robotic surgery a must-have nowadays?
PGH is the first government hospital that has acquired a robotic system, and we were able to do cases, robotic cases, even if the patient is in the charity ward or subsidized by the government. So it's feasible. We have shown it to be feasible to be able to do this to our the poor patients and subsidized by the government.
Which makes me ask a question to Dr. Pat. Where do we go from here? Available na ang robotic surgery here in the Philippines, or although in its early stages, but where do you see the trajectory? How can we improve from where we are right now?
We always try to follow the trend, and right now the trend, worldwide trend, is going into robotics. Again, I'm just speaking in terms of urological practice. So I think robotics is still the future when it comes to treating malignancies from the urinary tract. So that's a current trend for robotics. So we should, make robotics more accessible and available to more Filipinos, if that's the rest of the world.
Dr. Pat, given ba na kailangan techie ka to be a robotic surgeon?
You do practically the same things when you do robotic surgery. You just use a different tool. So it's not that difficult to learn how to do robotics. There are a lot of courses that you can take, and you can always call your senior or someone who's more knowledgeable than you to help you out when you do the first few cases. So I think as long as you want to learn it when you do robotic surgery.
With that, thank you very much, Dr. Patrick Tuliao and Dr. Hermogenes Monroy, for being with us today, sharing your expertise and your insights about robotic surgery. I'm Dr. Freddy Gomez, and thank you for watching Med Talk Health Talk. We'll see you again next time.